Dr. Farouk. I am the school director, and it's my privilege to be here today. And I want to thank all the family members that are here for our graduation ceremony. Our students, they have worked very hard in the last 11 weekends. They have been coming to school on the weekends. A lot of them work during the week. So they have worked very hard. They've been studying here at the school and also at the clinical site where they work with real patients and learn the job responsibilities that go along with CNA certification. And I am very proud to be here today because today they get their certificate of completion, after which on the 8th, I believe next month, they'll be taking their state exam. And there are a few review sessions that have been scheduled for them, and I would appreciate it if you guys allow them that time from here till they take their state exam to continue to study and pass that state exam, because if they don't pass that state exam, they will not be able to get their license from the state. So our goal is to not only get them to this point, finish the course, but then also help them pass that state exam. And families are very instrumental in that, because if they have kids, other responsibilities at home, sometimes it's hard to take time away and continue studying once you're done with the school. So I would appreciate it personally if you can please continue to help them and provide them the extra time that is necessary to get ready for the state exam. And I will go ahead, and what we're going to do is basically I'm going to call their names. They're going to come up, get their certificate of completion, and then they will line up here in the front. Once everybody has received their certificate of completion, at that point we do award perfect attendance awards to students that have not missed a single day of the training, which is a very hard thing to do. And then we also give out high academic achievement awards for those individuals that have done excellent work academically and also in the clinical side, and have achieved 92% or higher overall average throughout the course. So without any further ado, I would like to start presenting the certificate of completion. Actually, before I go there, I want to draw your attention to this number right here. This is group number 53 for this particular schedule, the weekend schedule. What that means is there's about, at least 250, 300 other students that have been through this training in this schedule and are working out in the field. So when they are finished and get that state license, they are in a good position to find a position or a job out in this community, because when they go out and apply for jobs, the facilities in this area, they already know the school and they know the quality of the students that we put out, so it would be a benefit to them. And we are a very small school, as you can see. We have classroom here, classroom next door. We have a lab downstairs. And a lot of our business comes from word of mouth. Students, when they finish, they find jobs, they tell other individuals, and they send students or other individuals or family members a lot of times, to come take the course here. And we would appreciate any positive remarks or recommendations that you can make. We would really appreciate that. Thank you. So without any further ado, I would like to call Rose Albito. Rose, come on up. Go ahead, stand right here. Please. Ione Bragg. May Jabo. Asra Hassan. And we have Sarah Pablo. Sarah. Sajda Shelton. Teresa Sweetman. And Ahmed Zaki. And last but not least, I have Ileana Zuniga.
Bravo!
Bravo! Congratulations. Here we go. So here's our small group of students, 9 of them who are finishing their training, and they have completed the total of 174 hours of training and now have received their certificate of completion. The only thing, on the graduation day, I do like to send my students out with a small word of advice, and I was thinking about what I was gonna, what kind of advice can I give to my students today, and I generally like to change it up a little bit so that way, but one of the things that stands out, or what I've been going through personally, I have had family members in the hospital, in the nursing home lately, and I would like to recommend that when you're out there working and taking care of patients, please treat them as a family member, because that one individual or one CNA can really make that difference. Okay, just to give you an example, my mom was in the hospital. Everybody that she came in contact with, from the doctors to the RNs, she was unhappy with. Why? Because they came in, saw her, said hello, and walked out. Or RNs, they would come in, look at a few things, and after that, they would walk out. Nobody would, talk to her, explain to her what was going on, and really, CNAs, or the position that you will get your license for in a few weeks, you guys are the first line of defense. If you have a patient who you're taking care of, and you know this patient to be active, walks every day, and eats every day, and today you go into work and you see this individual just laying in bed, not doing anything, well, you know that that's not right for this particular patient, or that's not how he normally is. So that should raise an alarm for you to say, you know what, this person needs help. Go ahead and talk to your charge nurse, talk to the doctor if necessary. You guys have to be that first line of defense and protect our patients from doctors and nurses and other folks that are probably just, doing all the paperwork generally, and you guys will be doing all the work. And I know that you guys have probably already seen the reality of medical field, right? Where things are not always as perfect and as beautiful as we would like them to be, but the goal here is that we're trying to make a change. We're trying to improve our nursing staff by instilling some of the values that are important when we take care of patients. So if we treat them as our family members and as our relatives, then little by little, that whole mindset will change, and we will have better nursing staff, better RNs, and better doctors out in the field. Okay, so I would really like to encourage you to continue to be that advocate and help those patients that are really in dire need of help. Okay, thank you. Now, let's go with the Perfect Attendance Award. You got a few in here. So first one goes to Ion Brock. May Jabo. Okay. I have Sarah Pablo. And Sajda Shelton. Congratulations. Teresa. And Juliana Zuniga. Our programs are short. nevertheless, attendance is so important because if they miss a single day, they're missing 2-3 chapters. And this program that they did was a weekend program, so they were here only on Saturday and Sunday. And the individuals that did receive the Perfect Attendance Award, I feel, that you have definitely demonstrated to me that you are a reliable individual, you show up on time, you get your job done. So if you do put me down as a reference and I pull up your file and I see that Perfect Attendance Award in there, it gives me full confidence to tell to that employer, hey, this person is reliable, is there every day, you can count on this person. So I congratulate you guys for that, okay? Now, these awards that I have in my hand now are for High Academic Achievement Award. The first one is for Ione Bragg again. May Javo. Sarah Pablo. Dr. Shelton. And Teresa Sweetman. Students did really well on their academics, and even in the clinical side, they showed excellence. So that's why their instructors recommended. Generally, for this type of award, we ask the instructor who they're recommending for High Academic Achievement Award, and these were the individuals that they recommended. So I congratulate you, and please continue to do the hard work. And a lot of you guys are young, and I would like to see you guys, don't stop here, especially, if you got all these awards, you need to build on this. This should be a stepping stone towards a higher career. I know CNA is a prerequisite for RN and LVN, some of those other programs, and if you really like this and want to continue to work in the medical field, don't stop at CNA. This should be just something that gets you going in this direction. And the state of California projects that there will be a 22 to 25% increase in this job market. So there's definitely job stability in this field. And if you like helping individuals and working in the medical field, this is a great way to go. So please take this and build on top of this, so later on you can come back and teach for my school. Okay? Be an instructor. Congratulations, guys. You guys want to kind of get together a little bit? Okay, let's get the tall people in the back and short ones in the front with me. Okay, I'm pretty sure. Okay, there we go, there we go.
All right, now a graduation picture. Throw your hands like you're. Woo! Here's a picture. Oh, that's all you got? Really? Come on.
Okay, the count of 3. You're gonna jump, okay? 1, 2, 3.
Jump!
All right, ready? We'll do one more.
1,
2, 3. Good job, Dr. Bruce.
Good job, sir. Good job. One more. Happy. Come on, guys. 1, 2, go.
There we go.
Now, before I let you guys go, does anybody want to say anything? Good or bad, I don't care. Because even negative, comments help us improve our services. So please, if anybody has anything to say, you guys are welcome to say it now. Okay?
Okay. I just wanted to say about our class, all the people in it, that they had a really good attitude. And the attitude reflects leadership. And that's our instructors. And they were really good too. and they change other people's attitudes. They change mine, but that's what I wanted to say. We have a very good class, some good people in our class.
Attitude can definitely make the difference, and a lot of times, you know, those individuals that you see at work that are grumpy and constantly, you know, are in a bad or have a bad attitude, it just affects the whole team. And you're right, you know, it definitely starts from the top and it comes down. If you have a boss who has a bad attitude, it's going to affect the employees and everybody else. So I appreciate those comments. Thank you. Anybody else wants to share anything? No? Then I would like to say thank you, and please enjoy your rest of the day. And there are days set up for you guys to come and review. So please do not stop studying now because you're so close to that state exam. I need you guys to continue to study and come and get the additional help that you need, especially on those review days. Please come and practice. And there are a few changes that one of our instructors did tell us about, so Ruthie will be updated on that. So when you come for the reviews, she'll let you guys know what changes to make. Okay? Perfect. Thank you guys.